His official bio, he is Deputy Consul General of the Consulate General of New York on behalf of the country of Israel. It is Israel's largest mission in the world, and Israel Nitzan coordinates the political work of the consulate in the 5 states within its jurisdiction, so not just the tri-state area, but beyond. He develops relations with national, state, and local officials and acts as a liaison for the state of Israel to the national and local leadership of the Jewish community based in New York. In addition, he coordinates interfaith dialogue and outreach for the Israel Foreign Ministry and its missions to the United States. And what I've been most impressed by is the nuance, the gravitas, and just the compassion and kindness that Israel brings to all of his work. He's not going to share this story right now, but he brings not only goodness of heart to the diplomatic missions of the state of Israel, but bravery, and has acted with real bravery in his different outposts in ways that I find inspiring. And today he's going to talk to us about Israel's work right now with COVID-19. I think that Israel is best known as the originator of applause for medical workers, but it is the originator of also so much research. It was one of the first countries to engage in quarantine. It's now one of the first countries to be reopening. And so I turn it over to you, Mr. Deputy Consul General. Thank you for being here with the East End Temple community. Thank you for your work on so many fronts. What is going on in the country of Israel? What's happening right now?
So since you insist on calling me Mr. Deputy Consul General, I will call you Rabbi, Rabbi Stanton. Thank you so much for this incredible introduction. I think that you're exaggerating, but thank you so much for that, and thank you for the invitation, first of all, and for the opportunity to engage and to speak and to share some thoughts, and maybe also to listen to your community at the East End Temple. And of course, it's I have to say that I'm privileged to be your friend and to enjoy your friendship, and that I appreciate and cherish very much. We discussed before that the topic and what exactly should I present, and I think that today the pandemic poses a challenge for all of us. In different aspects, a public health challenge, challenge of resiliency of communities, and I'm sure that your community faces this challenge as well. Economic and financial challenges, of course. For us, I think as diplomats, and our mission is basically to create content to our special relations here in the United States. Be it with the Jewish community as well as non-Jewish communities, as well as local governments, of course. And the challenge, we have a challenge, and we also have an opportunity, and it is intertwined. And I think that today we can talk about two main values: unity and solidarity, that are quite challenging. Because of the social distancing challenge that we all face, because of because of the fact that today, if we're talking about unity between us, the State of Israel, and the American Jewish community, like in this meeting, and the question is, how can we work together? How can we be there for you, and how can we be there for each other? And the expressions of unity, I have to say that we're struggling with this question of how to show our solidarity with the Jewish community in the United States. It's quite difficult. It's not that easy. How can we be there for you? There are some even For the first time, the state of Israel closed its borders to visits of Jews from around the world for the first time ever, and I hope that this will be over soon. But this is a development that is due to the situation, is due to the corona pandemic, but it affects also our relationship. So the question is, what can we do in order to be there for you? And I think that in many ways we're as in the consulate in New York, but we have seven more consulates in the United States. Try to be here, be there for the communities. We're trying to reach out to people. We're trying to speak with people. We're trying to find certain solutions to the needs of communities, of Jewish communities, and as well as non-Jewish communities. Part of it is also, for example, in very high level official engagement is phone calls between, like we had a few hours ago at 10 a.m. President Rivlin called Governor Murphy of New Jersey for a very short call, but to show and to express our solidarity with the people of New Jersey, and personally with the true mensch, Governor Murphy. We had another call 10 days ago with Governor Cuomo, and we're trying to see what can we do. So I'll open with a brief description of the situation in Israel. Let's talk about the facts as of this weekend. So we're basically, and I prepared some the numbers here. The total confirmed cases are about 16,500 positive cases we have, which is compared to New York almost nothing. We have about 25 new cases every day. Active cases, we have right now a bit more than 5,000, and numbers are going down. Severity of the pandemic, most cases, almost 98% are mild. We had 1% moderate and about 1% severe. Recoveries, we're talking about 66% of recoveries, which is again going back to the 5,000 numbers. So we have, of the 15, let's say 16,000, we have about almost 11,000 people who recovered, and 5,000 are still in treatment. The average age of those with COVID-19 is 81. So we're talking about the elderly people. The median age is 84. So we're talking about mainly elderly people who were affected by the COVID pandemic. Deaths, we have 1.5% of total cases, which is 240. I'm following the developments in New York. I'm sorry to say that all in all, you have more than in New York. We have now less, but it's more than 200 cases every day, which is devastating. We have about two death cases daily, which is very low. Now, in comparison to the rest of the world, these are statistics that look quite good. The overall mortality in Israel did not really change compared to the pre-pandemic period, but it is very difficult to compare between Israel and New York, because many areas in Israel have much lower density compared to New York, especially New York City, compared to the mass public transportation in New York. In Israel, unfortunately, I have to say the public transportation is not that robust and not that developed, and so I think that the interaction with the people is less close and intimate. Maybe I should say that based on what I described here, I feel like Governor Cuomo. So I should have started with saying that today is Monday, and but let's go back to the question of the response, the Israeli response. So Israel moved relatively quickly in addressing the pandemic, restricting flights, social distancing, etc. We were actually on January 30th, the end of January, we already restricted the flights coming from China. So China was not the main source. Let's say China was almost not the source of COVID, of let's say of the coronavirus to Israel. It was more Europe that was more difficult to close. And 2 weeks later, regulations were upgraded to include mandatory quarantine for all arrivals from other countries, especially Europe. I have to say that, for example, the first patient zero in Israel came from Italy, not from China, not from the East. It came from Italy. And even today, you know, with non to very few non-nationals entering Israel, we still have this mandatory quarantine of 14 days. We used to have actually up till today, it's still valid. Hotels run by the Israel by the IDF Home Front Command, there will be an ease of the regulations in which people will be able to have self quarantine at home, starting from the next few days, part of this process of reopening. We had a very robust lockdown policy that basically pushed the scale down and eased the pressure and the burden on the healthcare system in Israel. But still, we had what we call we had to deal with a unique situation that is also true to New York. That is what we call the Jewish Corona. The Jewish Corona is basically we needed a plan to deal immediately with Jewish questions, the questions of minyanim, the questions of operating the mikveh, the question of actually exercising the freedom of worship. In this process leading to Passover, we had especially the Haredi community. The Purim celebrations within the Haredi community caused a lot of and congregational gatherings in large numbers, led to high numbers of infections within the Haredi community. We dealt with that in basically closure of certain areas, what we call red areas, in which you have a high number of infections. Part of it was, for example, Bnei Brak, that again, going back to the IDF, the Home Front Command, basically closing down the entrances to the city, to some parts of the city, delivering aid, delivering goods to the families, and working with the community. And I think that part of the issue was also working in many ways. Like here, it took us some time to find the ways to work with the community leadership and the rabbis in order to make sure that the communities actually implement the instructions and making sure that they keep the social distancing practice. Non-Jewish communities, especially Israeli Arabs and Bedouins in the Negev, the majority complied fully with the restrictions. We see very low numbers of people infected within those communities. I should say something also about the Palestinian population. Right from the beginning, we had good cooperation with the Palestinian Authority. The UN even applauded the Israeli response. We have very good cooperation between the Ministry of Health in Israel and the Palestinian Ministry of Health. We transferred thousands of test kits in order to allow them to test to be able to mitigate the situation. Also, we transferred quite a large number of PPE personal protection equipment to the Palestinian hospitals. And we also gave them some guidance based on the practices of Magen David Adom and other state agencies in the way to and training the local Palestinian officials and first responders. So this is more or less the situation in Israel. If you have more questions, I'll be happy to answer. But what we're trying to do is let's talk about how do we move forward. So Israel is right now in the process of reopening. We, parallel to this process of reopening, we would like to basically since the situation is easier in Israel, we now have the government and other agencies and also the academia and the public and the private sector has more time and the ability to share from our experience. So let's talk about first of all what you mentioned, Josh, the R&D. The research and development, and I think that all in all is Israeli. First of all, the Israeli startup scene and the Israeli academia, they do not need us as the government to encourage them to work together. So whenever there is a need, they're there. They'll step in. And Israeli scientists and researchers and doctors are working diligently today on finding different solutions to different corona pandemic needs. The biotech research is being done by dozens of firms. Again, private sector is leading this effort together with Israeli universities. But I think that the most interesting thing is that basically we're talking about there is a very strong cooperation between the different players, which is the private sector, the academia, and the government. Part of it is also run by the IDF, by the Israeli Defense Forces. We have one main effort by the Israel Innovation Authority to encourage this creation of the COVID-19 solution ecosystem. They basically encourage and they motivate different companies they motivate them financially to find solutions. And if they basically, what the Israel Innovation Authority is doing is allocating a certain budget. It is quite significant. This is their policy, not only related to COVID, but they're doing it also with COVID. They basically invest with this is not a non-profit, of course, it's a government arm. So they invest in certain startup companies and R&D that could be, from their point of view, relevant to the needs of the country and humanity. That usually those companies would probably find it difficult to reach out to investors and to encourage them to basically use their money in order to promote this R&D. So this is where the government is basically stepping in and putting an additional investment to allow them to continue the R&D. So this is the Israel Innovation Authority. We have, by the way, another means of promoting R&D, which is a binational. It's called the Bird Foundation. I don't know if you've heard about the Bird Foundation. It's interesting because this is a foundation. It's a binational Israeli-American federal foundation to encourage joint R&D between Israeli and American companies. It's been running since the 70s, and they invest a lot in different frameworks where it's keep on developing, but today we have also an investment, a joint investment, Israeli-American, and again, the American is federal investment in joint projects of R&D between Israel and the United States in finding solutions to the corona pandemic. So, what are the latest news regarding the R&D? The latest news is actually coming from a government agency. Probably, I don't know if you've heard about it. It was in the media. The Israel Institute for Biological Research announced a major breakthrough in finding an effective treatment for COVID-19. The institute is running by the Ministry of Defense. It's a government agency that successfully isolated, and forgive me for not being able to explain beyond that, the antibody that effectively neutralizes the virus using blood samples taken from coronavirus patients in Israel. And basically, this is the first lab, probably in the world, as far as I know, that have achieved such a major milestone. The institute is now seeking for biological manufacturers. Basically, they want to find partners within that who could manufacture it and produce the treatment for clinical use. Again, it's a government agency. This is a non-profit, and we're willing to share this know-how with the world. Good news is also coming from another Israeli research organization, the Migal Galilee Research Institute. They developed an effective, by the way, they developed even before that, an effective vaccine against the avian coronavirus found in poultry, which has high genetic similarity to COVID-19. Now they are right now what they're doing is 4 years of research behind it, so it's already in progress. They're now on track to rapidly produce a vaccine against COVID-19 and developing an oral vaccine that will be ready for testing within 19 days. I have to say that 19 days for testing is still a long way to go until it would actually be finally approved. So we have different efforts by Israeli scientists to find ways to address this challenge by finding a treatment, finding vaccine, and for example, by the way, the United States recently granted a patent to Tel Aviv University, Professor Jonathan Gershoni, for innovative vaccine design against the corona family of viruses. So we work together with the United States. We work together between Israeli scientists and American scientists to find the vaccine. But the technology is not only to address, again, the specific vaccine or medical treatment. What Israeli R&D is also working, for example, for telemedicine. The day after the corona, the day after the pandemic, things are going to be different, and telemedicine is part of our effort. The Sheba Medical Center in Tel HaShomer near Tel Aviv, they developed a telemedicine program to minimize the contact between the medical staff and coronavirus patients. We believe that it would probably be useful for other cases as well, but it would probably also assist medical teams in actually, first of all, for medical checkups for people in quarantine at home, and also by minimizing the risk to those medical teams. We have other joint efforts out of everything, the Israel aerospace industry. They developed, and again, you quoted the New York Times. We were very unhappy with the way that the New York Times presented the Israeli technology as usually being used for killing people. But Israel Aerospace Industries developed not only weapons, but also they teamed up with the Ministry of Defense in Israel and the Technion in Haifa, which is the Israeli MIT, in order to develop a remote monitoring system that effectively minimizes the contact between caregivers and patients. They use incredible technology of advanced optical sensors using radar and AI, the artificial intelligence. But the idea is basically, again, knowing that we're heading towards a not only Zoom calls, but actually telemedicine. And we can actually find ways to support and to assist people in need while they're still at home. Again, part of the, we all face the shortage in ventilators. Here also, the Israeli Air Force joined forces with Microsoft and Magen David Adom to come up with a solution to ventilator shortage earlier in this crisis. And they basically, what they do is use a respirator, an open source, so it's they simply put the technology online so people can actually use it and manufacture their own ventilating machines. And all in all, I think that there is a national effort to find solutions to the different needs. And again, the different needs, the need is not only, not only the vaccine or the cure for the corona, but actually to many different aspects of our new normal, starting from basically today. Israel is joining forces taking part in the global effort to fight the pandemic. So I'll be very blunt, we're basically putting our money where our mouth is. And last week, Prime Minister Netanyahu participated in the coronavirus global response, which is an international video conference attended by dozens of world leaders very interesting, from the EU, France, Germany, UK, but also the leadership of Saudi Arabia was there, and some other Arab countries. And the idea is part of this global effort to what we would like to do is to support this global effort to address the needs of the international communities and to address the need to find a solution. So Israel pledged $60 million to this conference fundraising. So this is very rare that we actually are willing to really put money in such a fund. And this contribution will be shared by different international agencies, also UN agencies. The WHO will enjoy part of the money. And the idea is to find ways to developing, distributing treatments, vaccinations against the coronavirus. By the way, you're invited to a UN event that our UN mission is hosting, part of this global effort. I think that it should be tomorrow. I can share with you the information. We are going to join efforts with European, Asian, Latin American missions to the UN to discuss the role of science, technology, and innovation. It's going to be a full day of events, basically sharing the ways that we can actually work together to find solutions to this crisis. So this is we're also following here locally the process of reopening in the United States, and we're trying to look for solutions, Israeli solutions. For example, the need for tracking and tracing. This is since we're all following the press conferences of the governor, and we have a lot of we have, for example, an app developed by the Ministry of Health. It's called Hamagen. Hamagen in English is the shield, and it is an open source technology that you could find online today, in which basically, if you choose, it's a voluntary app. if you choose to use this app, it can tell you, it can tell if you've been in presence of anyone who has been diagnosed with corona, based on the database of the Ministry of Health. In many ways, even here, people, the state have such a record, and we're willing and we're happy to share it with local governments here in at least in our 5 states, but I know that we do it nationally as well.
This
Everything.
is wonderful. Could I
This
jump
is
in with a couple
what
of
we've been
questions?
doing. I want to speak about civil society because it's not only government. At the end of the day, we're not only the startup nation, but uh, I think that we can talk about the impact nation, and the Israeli civil society is very active. Also here, we have. I'm sure that you've heard about Israel. They work today with another humanitarian NGO. It's called Smart Aid. They are on the ground, just like as always, Israel are first in, last out, and are on the ground, affecting people and supporting them. The Israel Trauma Coalition, that we had really it's a wonderful group of psychologists who are trauma experts, and they are, first of all, they worked with us. We actually joined forces with them in order to assist the Jewish community in Pittsburgh following the shooting in the Tree of Life. They were very helpful also in Parkland, actually guiding and training the first responders and the local healthcare and mental health services. And we're working with them. We're working with them, connecting them to different communities, different federations, Jewish family services in the federations in the United States. We're working with them in order to basically assist also local state agencies. We had a conference call with the Department of Health of Ohio. There are different aspects of mental health support and they have a lot of experience. You should visit their website. They have a designated page for COVID-19 with very interesting guidelines for community leaders, for rabbis, for example, what should be done and how can we support the communities in need.
So,
So yeah,
first
so
of all,
basically we're here for you. We're here as a consulate. Please use us as a resource. If you think that there is any need of your community, if you think that there is any need with other communities who you work with and you partner with and you have a relationship with, and you think that we can find some Israeli solutions to their needs, we're here. We're here and we're happy to support. We're happy to together with you. We want to bring Israel, the good Israel, and to support the communities, to support the United States. It's part of our very special relations that we have, not only with the Jewish community, but with other communities as well. So again, we're here for you, and please use us. Please reach out to us. I'm happy to be here for you.
amazing. Thank you, Israel. Thank you to the country and thank you to the person. And we're so grateful. You brought in a number of dimensions that we are only beginning to think about in the United States. And someone sent me a question actually, which I thought was lovely, which is, when are we going to be able to go to Israel again? And in some ways, I'm wondering, a lot of us are starting to dream about the idea that New York could eventually open up. And I'm hearing behind the scenes from some folks where it's probably talking about June for some gradual return and partial reopening, but maybe that's even ambitious. Who knows? But Israel is weeks, if not months, ahead of us. What is the process of reopening Israel like internally? And then at what point will it be open to the wider world again, physically, in terms of being able to have movement in and out of the country?
I think that we should differentiate between the Israel process of reopening and let's say some broader questions of the future of aviation and the future of travel. That are not only, let's say, dependent on Israel. So Israel actually started these days the process of reopening um, based on criteria that is also shared by, again, if we're following the press conferences of the governor, I think that we're all on the same page on what exactly, the need to reduce the numbers, to make sure that the numbers go down to a reasonable pace, especially the infection rate that is less than 1. I think that if you're familiar with that, it's more than 1, meaning that each infected person can actually infect some more than 1 person. So the criteria is less than 1. We are there already, and the country is starting to reopen. We The idea is also to encourage, basically, to facilitate the renewal of the economic activity in Israel. So we're starting today a process that should lead to more or less mid or late June in a gradual reopening, dependent again on the medical situation and the pace of infection. If it stays down, if it stays at less than 1, we can actually proceed. There are some, as I said, easing the process to ease the restrictions, meaning that people who travel to Israel could actually spend 14 days of quarantine at home and not in a hotel. I can tell you that in many cases, most of the people, we dealt with a lot of emergency cases in the last 6 weeks of people who actually really needed to travel to Israel, and this 14 days of quarantine turns the trips into almost a mission impossible, because people cannot spend 2 weeks, travel to Israel to spend 2 weeks in a closed room. Next is a good question. Next is, I think, that is more related to the overall global regulations of flights. There are very difficult questions of how can you actually keep social distancing on an airplane. Right now, we actually have 1 flight left active. It's United flying to Newark. El Al is not flying at all. El Al is in a situation in which basically it doesn't, the question is a question of whether or not these flights can benefit the company, and what is the role also of the government in operating such an airline, keeping the flights ongoing. The situation is also, and again, let's talk about the United States and especially New York, the situation is also related to the situation here, whether or not there will be let's say, if the situation will improve. Right now, New York is in better condition compared to the rest of the United States. The question is what's next after. Again, who knows when New York City is going to reopen. So I know that there are discussions today on how exactly to do it, how exactly to operate the return of flights, how exactly to address the concerns of a possible scenario in which we will re-import the coronavirus from abroad. There is no real right now. I do not have any news on that, other than the understanding that we do need to address this question, and there are already discussions internally in Israel, but also with the airline companies, as well as bilaterally with different countries in Europe as well as in the United States.
Thank you. So, one of the interesting aspects I've been grappling with is the number of people who want to make Aliyah and want me to serve as their reference has gone up significantly. And I'm kind of surprised at that. I think it's a fascinating phenomenon. Is this just what's happening in the East Village in New York City? Or is this happening across the board that people are saying, hey, Israel might be a pretty good place to be right now?
Israel is always a good place to be but I think that well, yes, we see this process. We also see the process with this same phenomena with Israelis who live here for many years and never registered their children, and suddenly at the age of 15, 16, the kids, we basically assist whoever we can assist, but right now there is unfortunately I have to say, because it goes back to the question of closing the borders. There is a freeze in new applications for Aliyah. We're in touch with many communities, with many people who actually want to make Aliyah to Israel. They're always welcome. But we're basically discussing this internally. Since this process of reopening in Israel only started, I believe that we will see some kind of an opening soon. I hope. I don't know when, but it is on the agenda, part of this overall effort to reopen the country.
So, in the United States, one of the painful realities we are coming to recognize is how much COVID disproportionately impacts lower income communities and communities of color. And in Israel, which has, a totally different framework, I'm wondering if some communities have been impacted more than others, or if, you mentioned the Haredi community based on at certain points, its lack of social distancing. Have there been other communities in Israel that have had to face this in really difficult ways?
You're talking about the aspect of the spread of COVID-19. So the answer is no. As I said, even among the Arab and the Bedouin communities, the numbers are relatively low. They've been following the instructions, and so the numbers are still very low. There are other aspects of the financial burden and unemployment that affect certain communities in what we call the periphery, which is outside the state of Tel Aviv. This is something that is the government is trying to address today in different programs to support businesses, especially smaller and medium-sized businesses in certain communities that are outside of the center. Um, I think that this is the main challenge when it comes to, let's say, other communities. One thing that I should say is also that going back to our work here, we would like to, again, when it's possible, we are planning to develop to find some programs in order to address especially the question of resiliency within communities of color in the day after COVID-19. We hope that we'll be able to do it this year. It's part of our program of work. But the idea is to bring Israeli professionals, for example, again, going back to the question to the Israel Trauma Coalition, and to bring them to certain communities, to give them the tools and the experience in order to address the question of resilience, of the well-being of the community, and basically to address their needs with tools that are available in Israel.
Makes a huge amount of sense. Um, what have you learned about Israel that you yourself didn't know? There's a lot of self-knowledge that I think people are gaining in the course of this. Some of it is really painful in the United States, and some of it is beautiful. I don't think I've ever had so many interactions filled with love, even remotely on Zoom. What have you learned about Israel that is uplifting and positive in the midst of this challenging time?
I think that many of you who visited Israel know that we can be quite aggressive in our interaction with each other. But I think that today this is I share your impression that it's also true to Israel. People actually are becoming more supportive. We find ways to assist each other, especially when it's related to certain communities and persons at risk. There are different, again, going back to the wonderful civil society in Israel, different nonprofits supporting communities in need, supporting people who simply cannot get out of home because of this of the situation, and they find ways to deliver goods and groceries to the elderly straight to home. Some people, I watched, I saw it. There was an item in the Israeli news a few days ago, in which people simply show up right across the door in order to speak to have a conversation especially with elder people. This is again, they keep on the social distancing practice, but at least they give the attention, they give the people this personal feeling that they are there for them, and in addition, of course, to the use of technology of Zoom. I think that in many ways, even though we're socially in distance, our interaction has been intensified with different with family. Even though we could not celebrate the Seder together, we had the Zoom Seders with some in some cases. We had, for example, at the consulate, we had a pre-Seder Zoom gathering in which we congratulated each other, Chag Sameach and Happy Pesach, and we sang together the four questions. Yes, it was the catastrophe we expected it to be, singing all together. But this is something that we simply, usually you do not think about it, that you have the opportunity to meet right before a meaningful event and to be together and to support each other. And yeah, so yeah, I think that we learned that again, going back to unity and solidarity. Yes, this is one thing that I learned also about the Israeli people.
So there's a proud alumnus of Cornell University who happens to be in this conversation. And this very anonymous individual is wondering about the collaboration. Yes, the anonymous individual might be Elliot Carlin, um, is wondering about the collaboration between Technion and Cornell on Roosevelt Island, and whether the campus in the United States that is a collaborative project and sort of the embodiment of the best of collaboration between our countries is actually doing COVID related research. And if so, what projects are they working on jointly?
Well, I have to admit that I don't know if they have a COVID focused project. I know that there are different engineering projects. We also have, I think that they also have some information technology and cyber project that they're running together. I have to admit that I don't know what's going on over there today during this again, period. But we researchers communicate with each other via Zoom, emails. They do not necessarily need to sit together in the same place or the same space in order to collaborate and to work together. So this was my answer. Basically, I have to admit I can check, but I don't know exactly what's going on there right now.
Uh, what what are you hearing across the board? So you work with New York City and five states in total. So it's New York, New Jersey, Pennsylvania, um,
Delaware and Ohio,
Delaware, and Ohio.
a taste
Those
of the
states,
Midwest. Yes.
those states could not be more different in terms of their experiences so far with COVID, and also with the ways in which the Jewish communities are organized. What do you see as the greatest need with across those five states? And how is the consulate planning to step up in order to be of service to the Jewish community in those five states? And in order also to be of service more broadly? You've described in a wonderful way how the consulate is supporting the New York City community. Once in a while, it's good for New Yorkers to look well beyond our borders. And I'm wondering what we should be looking at and what you are looking at.
Um, let's start with the Jewish community. We New York City is different in many aspects, but we've been in touch with all Jewish federations in our five states. We have quite a lot, and the idea is basically, the idea is to call them to say, listen, we're here. What do you need? How can we help you? There are. I won't get into the financial burden and the financial challenge for some of the federations. This is one thing that we cannot do. But again, going back to asking what are their needs, and if we can actually make the connection and find solutions to the needs of their agencies. For example, Jewish Family Services, if they need any specific guidance in order to support their communities. Also to use this as an opportunity, again, going back to their relations with other communities, non-Jewish communities, communities of color, others, who basically we can work together in order to bring Israeli solutions, to bring Israel. I keep on saying Israeli solutions. I should not use this because this term, because we need to we actually learn from each other. We're not. Israel has a lot to give, has a lot to share, but Israel also has a lot to learn, and this is what we're trying to do. There are, of course, other, let's say, communities, other Jewish communities in our region. I have to admit, the question of anti-Semitism is a matter that is a source of great concern for us. We've been following this situation. We've been following expressions of anti-Semitism online. It's been sliding out, dripping out into the real world. Going, listen, we've been following the situation in the demonstrations in Ohio against Dr. Amy Acton, with some expressions of really anti-Semitism when it comes to her Jewish identity, even though they do not necessarily use the term Judaism or Jewishness. But it's something that we've been following, and we also convey some very strong messages on this question. We work also with local governments, as I said. We try to we reach out. Now, New York and New Jersey are a special case anyway because of the really they were affected in a devastating way. So New York City, New York State, and New Jersey That's the reason, by the way, for the phone calls from the governor, from the president of Israel to the governors in order to basically convey our support and solidarity. We work with different government agencies. For example, we are in touch with the Israel Homefront Command, who are part of this emergency management effort in Israel, to share best practices on different areas of dealing with the question of how to manage the emergency situation. How to run, for example, how to run quarantine hotels if needed. Again, we have some experience also with the Haredi community, how to engage, and again, in the very basic, the very basics of how exactly to communicate with the community that does not work online, and how to convey the messages, and how to make sure that they have all the information, and they comply with the instructions. There are a lot of questions that we have some experience that we can share, and we also want to learn. We work with we're happy to work and to learn from experience of others as well.
So one final question. I got two good ones, and I have to choose one of them. I feel like you already spoke about how Israel and its testing and tracing is going to potentially be a model in the open source applications. In this case, I'm wondering, in the United States, we've seen the upswing of the BDS movement, the boycott, divestment, and sanctions movement. And now all of a sudden, everyone needs Israeli technology. And I don't think people are going to boycott, divest, and initiate sanctions against the country that might, in fact, help us take important steps towards a cure and or a vaccine. Do you think the trend away from BDS might be longer term as a result of Israel's obvious innovations in this area?
Um, it's a good question. It's a good question. I think that since I believe that a key motivation in most cases of BDS are not necessarily related to what we're doing or not doing, or our contribution to the well-being of the world. It's more related to questions of anti-Semitism and Israel's right to exist as a Jewish state. Um, I think that this is, I don't see it, let's say this phenomena diminishing, but I think that by actually, and this is what we're doing here, being on the ground, meeting people, sharing again what we have, the best practices, finding ways to work together, encouraging Israeli nonprofits and American nonprofits to work together, to encouraging Israeli R&D and American R&D to work together. I think that we can find this phenomena even much better.
Israel, thank you so much. And I mean that in both senses. Thank you for your wisdom, your kindness, your humor, and your ability to show that it is possible to have adult conversations, even with kids in the background, in the best of ways. You are immense, and I'm so glad that you and I will get to have not one, but two lunches together this week. So sincerely, thank you. We
Thank
so
you so
look
much.
forward to continuing the conversation, and be well. Our very best to your family as well.
Thank you. Thank you so much. Thank you very much to all of you.
All right. Take good care.
Take care.